Good afternoon, good evening, good morning, wherever you are from around the world. My name is Ravi Mamtani. I am professor and vice dean at Weill Cornell Medicine in the state of Qatar. And I welcome you all to yet another fascinating session from our Population Health and Wellbeing series. And a reminder that the objectives of the series are, number one, discuss contemporary and critical topics relevant to healthcare, medicine, and population health, examine evidence-based practices germane to public health and patient care, and describe opportunities and challenges in the evolving face of healthcare and population health. A couple of housekeeping notes. Your cameras and microphones are turned off. Please use the Q&A feature to type questions and or comments that you may wish to make. And questions will be addressed at the end of the session. This activity is accredited by the Accreditation Council for Continuing Medical Education in the US. And also by the Department of Healthcare Professions in the Ministry of Public Health here in the state of Qatar, and approved for a maximum of 1 hour of activity. Insofar as evaluation and certificates are concerned, the post-activity evaluation will be available in your Cloud CME account by January the 21st. You will receive an email notification once the evaluation is available in your Cloud CME account, and your certificates will be available for download once you complete the post-activity evaluation on the Cloud CME portal. So this is the fascinating topic that we have for today. It's entitled Evidence-Based Use of Nutrition Supplements. And our speaker this evening, is a very distinguished guest from the US, namely Dr. Benjamin Kligler. Dr. Kligler, and I'll just take a moment or two to introduce Dr. Kligler. Dr. Kligler is the Executive Director of the Office of Patient-Centered Care and Cultural Transformation for the Veterans Health Administration in the US. He's professor of family and community medicine at School of Medicine at Mount Sinai and past chair of the Consortium of Academic Health Centers for the Integrative Medicine. Dr. Kligler was the founding medical director of the Center for Health and Healing and Integrative Medicine Practice, which opened in May of 2000. As you can imagine, he's had many years of experience. In addition, Dr. Kligler was the co-director of the famous fellowship program in integrative medicine in New York. And I could go on Dr. Kligler, and I'll be brief. Dr. Kligler completed a 5-year academic career development award from the National Center for Complementary Medicine at the NIH in the US in 2015, and was co-principal investigator of the recent PCORI-funded trial comparing individual and group acupuncture for chronic pain. He has published extensively, written amazing articles in peer-reviewed journals, and also authored several chapters in books. He has lectured and been a wonderful teacher. He's a great supporter of programs at Cornell and Qatar. And I want to thank you, Ben, for taking the time out of your busy schedule to be with us this morning on the eastern coast of US, New York, but a late afternoon, early evening for us here in Qatar. So thank you so much. And please, with that, please welcome Dr. Kligler to be with us this evening. So thank you so much, Ben.
Great. Thank you so much, Ravi. And I'm very, very happy to be here. Let me go ahead and share my screen and make sure that works. Okay. Okay, hopefully now you're seeing my slide?
Yes.
Okay, beautiful. Yeah, thank you so much for having me. I always really enjoy working with Cornell Qatar, just such a wonderful group and wonderful organization. So I'm charged with covering what is actually a gigantic topic in more or less 45 minutes so that we have time for questions. And so I will talk fast, which fortunately I'm from New York, so it's not hard for me to talk fast. I have no conflicts of interest. And this is what we're going to cover. Talk about 3 specific examples of evidence-based use of nutritional supplements, talk about where we really want to focus on whole foods rather than supplements, and then talk a little bit about safety labeling, good sources of information for you to access to make the best use of what's out there. And, rather than try to give you this is blurry on purpose, so don't try to adjust your screens. I'll explain why in a second. Rather than give you an exhaustive list of, everything we know about every supplement, which would take days, let alone hours, let alone 1 hour, I want to give you kind of an overview from the perspective of what are some of the challenging issues that kind of come into play when you're learning about supplements, when you're working on bringing them into your practice with patients. So the reason this slide is blurry is that this is how our patients, or even how we may feel sometimes when we go into the pharmacy to look for a particular supplement, whether it's, vitamin D or St. John's wort or whatever it might be. It can be very daunting and very confusing, and it can be very hard to sort out where is the good information. And in honor of the fact that this is being hosted in Qatar, this is what it can feel like when you're trying to step out into the world of using supplements with your patients or with yourselves and your family. It can feel very alarming. Not a lot of signposts or no good map. But at the same time, there is a lot of really good information, and there are also some basic principles that I think are really useful to share. One of the basic principles that I will come back to is that in many cases, and you'll probably be tired of hearing me say this by the end of the talk, the best source of nutrients or nutritional components is actually in food rather than an extract in pill form. We have, I think, in medicine and healthcare generally, a bit of a romance with pharmaceuticals, a bit of a sense that if you can package something and put it in a pill, it will magically be more effective than if you get it into your body in a more traditional way. And so, as you'll see when I talk, you'll read a lot about evidence of the health benefits, whether it's antioxidants or vitamin D or fish oil or whatever it might be. But when you start to dive into the evidence, a lot of the really strong evidence is about getting these nutrients into our bodies from food. And when we do randomized clinical trials or other prospective trials, sometimes the extracted nutrient doesn't hold up as well. So you'll hear me referencing again and again the idea of food as medicine and the potential of these nutritional elements to really help us when they come from food. And just as kind of a common platform or a common starting point for talking about diet, this is the Mediterranean diet. I probably do not have to explain what this is to you all. You all know about it. And this is really the diet, although there's lots of information about different diets, this is really the diet, generally speaking, that is best supported by evidence as far as promoting health. It doesn't have to be really the Mediterranean version of the Mediterranean diet. The principles, it can be something that's modified very much for other cultures around the world. But the basic principles of a largely plant-based diet, a lot of diversity, a lot of colors in terms of fruits and vegetables, including oils modestly, but generally speaking, monounsaturated oils if possible, including fish and nuts in the diet, and using whole grains. These are kind of the core principles. It's not so much that it has to be any specific type, as in it doesn't have to be olive oil. There are other oils that are just as helpful. So those are the principles of the Mediterranean diet, and you'll hear me reference back to that kind of multiple times. So I know you all are from all over the world. At least in the States, there's a notion that a multivitamin is something that people need. About 33% of Americans take a multivitamin daily. We spend $6 billion on these multivitamins, probably more now. But when you look at the evidence, including this recent review in Journal of American Medical Association, there really is no clear evidence that taking a multivitamin adds to our health overall. What do we do with that? Well, what I do with that is I really take the opportunity with patients or when people are asking for nutritional advice, just to share this and say, you think a multivitamin will kind of give you the easy way out. But when you break it down and you look at the benefits of extracting these kind of major nutrients and putting them in a pill, they don't measure up to what we know about the benefits from food. Having said that, there are a few groups of people who you might want to consider a multivitamin. Most of these are people who either by choice or because of medical problems are not able to take in the food that might be healthiest for them. So you can see teenagers leading the list. If you have teenagers, you can understand why that might be. But then people who are on very restricted diets, people with impaired digestion, etc., as well as seniors. So I'm not trying to say that absolutely no one needs a multivitamin, but I think it's good to say we should pause for a minute and think about whether that's the best way for a given person to get what they need in terms of the spectrum of nutrients and micronutrients. What I will say is, again, at least in the States, sometimes if people are taking a pill, they feel they're doing everything they need to do for their health, and they don't need to do the hard work of going to the grocery store, picking out the right foods, preparing them properly, and that's where they're going to get the benefits. Vitamin D, one particular vitamin that's really worth mentioning, again, because it illustrates a really, I think, important principle. So one thing you'll see in this field is when kind of some new evidence or a new study for a given nutritional supplement hits the medical literature or hits the popular literature, there can be a huge wave of popularity and support. And suddenly that particular nutrient or supplement is the solution to everything. It's just good to be cautious about that, because we just have a tendency, I think, again, to look for miracles and miracle cures, and they're really not out there for the most part. So vitamin D is a good example. Not that there isn't a role for vitamin D supplements, but over the last 20 years, really, a great deal of evidence accumulated indicating that low vitamin D levels were associated with a higher risk of many different kinds of conditions: diabetes, hypertension, multiple sclerosis, multiple kinds of cancer. So in other words, people with low vitamin D turned out to have higher risk of these diseases. Do we know if that was cause and effect? We don't. So this was, you probably would call it epidemiological or observational evidence showing low vitamin D level, higher risk of certain diseases. So out of this grew a notion that really everybody should be supplementing vitamin D. We should be monitoring vitamin D very vigorously. But it turns out, and this is based on a recent study called the VITAL study, vitamin D and omega-3 trial, not so clear if actually supplementing with vitamin D supplements will have any specific benefits in terms of health or disease prevention. And you can see in this slide, 1/3 or more of US adults 60 years or older take vitamin D supplements. This isn't even including people who get their vitamin D from multivitamins. But do we really know that there's any benefit? And so when they looked at this in a prospective trial, they couldn't find any associated health benefits in older adults, even in people who had low vitamin D levels. Does this mean there aren't individuals who might benefit? Does this mean there aren't subpopulations? It does not mean that, and I'll talk about that in a second. But at the same time, it probably means that there's no good rationale for giving vitamin D supplements across the board. And whether or not there's good rationale for even monitoring vitamin D levels on a routine basis is really an open question. And I think part of why I wanted to make sure I discuss this is I was right there on the bandwagon on the train with everybody, very excited about the potential of vitamin D, routinely testing in my practice, recommending it. And, it's very easy to get caught up in that momentum when some new information becomes available. And, I don't think we've done anybody much harm other than perhaps a bit of wasted money on testing and potentially on supplements. But it's just very important to kind of keep up with the literature about supplements. I mean, that's true about everything, but I think in particular, supplements, as time passes, sometimes something that we were quite sure of, quote unquote, turns out to be fairly debatable. And I'll say more about that when I talk about glucosamine. So just to say a bit more about vitamin D, it isn't present in so many foods, fatty fish, liver, cheese, egg yolk. We do have in the States and in many other countries, many foods that are fortified with vitamin D, milk, cereals, juices, etc. So that is an easy place to get it. But of course, primarily, we get vitamin D from being out in the sunlight because we manufacture it. We convert the inactive to the active form in our skin, and it takes surprisingly little sunlight to do that. And so I think one thing that's important in regards to vitamin D is we've been very afraid of ever telling patients to go out in the sun, at least in some of our countries, because of worry about skin cancer, et cetera. The amount of sunlight it takes to convert adequate vitamin D for most of the year in most of the world, putting aside very, very northern climates, it's not that much. It's really, 45 minutes, an hour out in some sun exposure, arms and legs exposed. It's not a situation where you're basking in the sun for 8 hours a day to get adequate vitamin D. So I think that's one thing we can think about differently is, are you getting any sun? I know in some cultures, there are cultural issues as far as really people being covered up when they're out in public. And I understand that's an issue, and that may require kind of adjusting this idea and this concept, but there are easy ways to get adequate vitamin D. So having said that, again, as with the multivitamin, there are a few groups of people. Breastfed infants, it turns out, is one of the places where there's the best evidence. Breast milk, for whatever reason, is not very high in vitamin D. And so there's a recommendation across the board that breastfed infants get 400 units daily of vitamin D3. And I don't think one can quarrel with this. People who get limited sun exposure, people with especially dark skin where they're not converting their vitamin D as readily, people with fat malabsorption because vitamin D is absorbed with fat when you do take it in, bariatric surgery, strict or restricted diets. So these are categories of people where taking a supplement of vitamin D is probably reasonable. As I said, for infants, 400 units a day. For adults, 1,000 to 2,000 units daily. For adults who are diagnosed with significant vitamin D deficiency, as you all probably know, you will often see a more intensive regimen of short-term, very high-dose therapy to replete that. So that's where you get the 50,000 units a week, et cetera. But that should be short-term and not a long-term approach. I realized I forgot to mention at the beginning, ordinarily I like to interrupt for questions, but because it's a relatively short session and a very large topic, I asked that we could take questions at the end. So hopefully you all are jotting down questions. I will make sure to leave 10 to 15 minutes at the end to make sure we cover the questions that you have. So please write them down as we go along, and we'll make sure we get to them. One other category of vitamin that I just like to mention, again, because this has been an area still where I think we're still learning. So antioxidant vitamins, vitamin C, vitamin E, beta carotene, lycopene, a number of other substances. Really a lot of epidemiological evidence from studies of diet in different cultures showing that populations that have higher intake of green and yellow vegetables have reduced breast, colon, gastric, cervical, a number of other cancers. The theory behind this is that a lot of cancer damage is done by free radical generation, and antioxidants can help kind of absorb those free radicals before they might damage a cell or contribute to a mutation. So for a long time, there was the notion, and this now is probably 15 or 20 years in the past, but again, same idea as we just talked about with vitamin D, this idea that everybody should be taking antioxidants. But it turns out that when you look at the actual studies, in other words, prospective studies where they have randomized people and either given a antioxidant in vitamin form or not given it, you really find that there's no benefit in preventing the development of some of these cancers. And in fact, in some of them, for example, lung cancer and smokers, when they are given carotenoids in supplement form, so beta carotene, et cetera, they actually have an increased risk of lung cancer. So, I think the other thing about this idea that just because vitamins are natural, that they can never cause any harm, I think it needs to be attended to. I don't think one will ever hurt oneself by eating enough carrots or other carotenoid containing vegetables. But it's clear that at least in some subpopulations, higher doses of supplements taken in the extracted form can lead to increased risk of certain problems. So again, what this goes back to is the idea of getting your food, getting your nutrients from your diet, and that there are definitely ways to eat that increase our likelihood of taking in, for example, antioxidant vitamins in green and yellow vegetables that ultimately reduce our cancer risk. There is one, I think, really important trial and application of antioxidants in supplement form, and this is called the AREDS trial. This looked at acute macular degeneration, which is a leading cause of blindness really the world over. And people who have early AMD were found to be able to reduce the progression by taking this supplement, which was comprised of vitamin C, vitamin E, zinc oxide, copper, and lutein and zeaxanthin, which are also antioxidant nutrients. And this trial, I think, is important because this is such a common thing. The nutritional supplement here is quite safe. Now, could this be substituted for by just really attentively paying attention to eating lots of green vegetables, eating lots of yellow vegetables, potentially? And what generated this study to begin with was this concept that people who eat more of those vegetables appear to have a lower risk of developing macular degeneration. So it goes without saying that this doesn't invalidate that principle, but it does say that once a person is diagnosed, really may want to consider this supplement. Whether or not taking the supplement leads to a decreased chance of macular degeneration, we do not know. We do know that eating diets high in leafy green vegetables and orange vegetables does contribute to a decreased risk. So as you can see, this is kind of where we go full circle when we talk about vitamins, nutrients, micronutrients. And I'll just say it, other than in specific populations like people with restricted dietary intake, absorption problems, et cetera, it's hard to point to an area where definitively we would say you should supplement this vitamin. Really what we should be talking to people about is, what are you eating? How can you adjust your diet in the direction of more fruits and vegetables, more variety, more whole grains, nuts, simple oils, et cetera. And I know that that's not the typical position for in many parts of the nutritional medicine world. People are still advocating taking vitamins kind of across the board. But I think personally, I think the evidence is really moving towards a much greater emphasis on food. So let me move on to talk about some supplements that are not necessarily contained in foods where we may in fact want to take them as a medicine. And I want to talk about glucosamine as a kind of a case study, and I'll show you why. Glucosamine is, there's the chemical name, I won't bother trying to pronounce it for you. It's been around now for probably 30 years plus. and been pretty consistently recommended for mitigating the symptoms of osteoarthritis. This is the dose you can see there, the typical dose, 500 milligrams 3 times a day. It's often combined with chondroitin, which is given at 400 milligrams TID. It's also often combined now with quite a number of other nutritional supplements, MSM, SAMe, S-adenylmethionine, a number of other supplements that appear to also have some potential impact on osteoarthritis. So I'm not going to necessarily go into kind of all the various ways one can take glucosamine, but I want to use this to kind of highlight a part of the journey, a part of the process of how we should evaluate supplements. So this is in the mid-90s, personally, not to divulge my age, but this was early in my career. And there were several studies like this, mostly from Europe, looking at people with osteoarthritis of the knee and comparing glucosamine to other treatments for pain and symptoms in arthritis. And so this one compared it to ibuprofen and basically found that glucosamine was as effective as ibuprofen in reducing symptoms, except only 6% of people on glucosamine had adverse effects and 35% of people on ibuprofen. So we know, for example, that medications like ibuprofen and nonsteroidals often have GI adverse effects associated, and therefore something that works as well without the side effects obviously is very appealing. Here's another study, also interesting. This one was in Lancet, and these are a long time ago, so I'm not advocating making decisions based on these, but I'll show you where it all adds up. So this study looked at a long-term study, 3 years, osteoarthritis of the knee, and not only tracked symptoms, but also tracked x-rays of the people taking glucosamine, and even found that in the glucosamine group, there was less loss of joint space. So this is a physiological measure of progression of arthritis. And at least in this study, it appeared that glucosamine not only helped with symptoms, but maybe actually helped with the underlying process of the disease. So very popular supplement early in the late 90s, early 2000s. Then a very large study was funded in the States by NIH, ultimately published in New England Journal. Almost 1,600 patients compared glucosamine to chondroitin, to the combination, to celecoxib, which is Celebrex, it's a COX-2 inhibitor, and looked at patients with knee pain and whether they had a decrease in knee pain. This study found that glucosamine and chondroitin were not significantly better. Now, what's interesting though, and the principle I think I want to illustrate here is sometimes you have to go past the headline. So the headline, what was summarized in the popular media, in some of the sort of digests that give us information about new research, you got the headline, glucosamine chondroitin not effective. But then when you say compared to placebo, and you look at that parentheses there, 60% placebo response in the study. Now, you all probably know typical placebo response in a pain study, 25 to 30%. For some unknown reason, this very large, very expensive study, they had a 60% placebo response. So, you know, the glucosamine chondroitin benefited 63%, 64%, which was not significantly better than placebo. But at the same time, 2/3 of people got better. So this, I think, kind of illustrates to me the challenge of not just taking information at face value. Now, does that mean that the conclusion was not correct? No, it was technically correct. Glucosamine was not significantly better. But part of why is that the placebo response was so strong in the study. This, though, really led to many of us not wanting to prescribe glucosamine for a long time, because if you don't read between the lines or below the headline, this really makes you think, well, this doesn't do anything. I will say one thing that's important that was sort of a secondary finding is that last bullet there. People with more severe pain had a greater response with the combined therapy. And this was important because it's very hard to know from the literature, does one give just glucosamine, glucosamine plus chondroitin, glucosamine plus something else? And at least in this large study, the group that had more severe pain did really much better with the combined treatment. As you can see, they had a 79% response rate versus 54% placebo in that group. So that is one takeaway that's pretty clear. But for a while anyway, this led to this headline that the glucosamine chondroitin combo did not work in arthritis. But then, as more time passed, more studies emerged, and that study kind of got a larger context. The general recommendations have again kind of changed and shifted. And they've shifted in a much more positive direction, so that there's a lot of reason now to consider using glucosamine. And what I want to show you, I'm going to talk about this at the end in terms of resources, but this is probably the most definitive resource you can turn to for evidence-based information about nutritional supplements and herbal medicines for that matter. This is called the Natural Medicines, used to be called the Natural Medicines Comprehensive Database. And it's put together by a group of pharmacists who are very committed to keeping it evidence-based and accurate. It has fantastic monographs about hundreds of supplements and herbs. And so just to give you an example, if you were interested in really, well, how do I put all this together about glucosamine? You can see that Natural Medicines gives it a rating of likely effective for osteoarthritis and goes into the details there. But this is based on kind of an accumulation of all the trials and all the systematic reviews. And in my view anyway, Natural Medicines is fairly conservative in terms of where they end up in making recommendations. And so when this is where they come out, they help us put some of that confusing or conflicting information in context. I will say one downside about Natural Medicines, it is a subscription database. So if you're an individual clinician in practice, you do have to pay. I haven't checked the price recently, but it's, I think, probably around $100 US a year. But many, because this is the definitive source, many hospitals, medical schools, other healthcare institutions now have this as one of the databases in their library. And so I know, for example, at Mount Sinai, you can access this through the Mount Sinai library without paying your own subscription. So I would highly recommend you all to look into this as to whether you have access or whether you may want to think about purchasing it. Okay, I know I'm racing through a lot of different perspectives, but I want to sort of give you not just some information about a few supplements, but really a context for how to think about it. So the next one I want to talk about is, as you can guess from this, fish oil. Fish oil and particularly omega-3 essential fatty acids, this is back now in the 70s, first generated interest because of the lower incidence of MI in Native Alaskan groups. And this question of, is there a connection with the very high percentage of fish in their diet? So subsequently, there have been a number of clinical trials of fish oil supplements for multiple conditions: ulcerative colitis, psoriasis, post-MI, cardiovascular disease, arrhythmia, depression, rheumatoid arthritis. Really, there is so much literature now about fish oil. 2,000 to 3,000 milligrams daily. When you look for fish oil to purchase, you will find a number of different products. The key thing is that they have a DHA and EPA, docosahexaenoic acid and icosapentaenoic acid. These are the most biologically active essential oil components in fish oil. And so you'll see supplements that are more DHA, more EPA, and there's a lot of debate about which is better for which kind of condition. And that's a little bit beyond the scope of what I can offer here. But that's, for example, something, if you're interested in learning more about that, I would go to Natural Medicines database or some of the other sources I can share, and you'll be able to get a lot more information. There is a concern about whether fish oil in supplement form can have an anticoagulant effect. It does inhibit platelet aggregation. And so some people will say someone who is on other anticoagulants, someone who's on Coumadin or other blood thinners, perhaps should not take fish oil supplements. It's really debated. I don't think there's conclusive information about that. So what do we have the strongest evidence for? In hypertriglycerides, fish oil is very effective. Rheumatoid arthritis, there's moderate evidence of significant impact on symptoms. In infant brain development, interestingly, there's a lot of evidence that infants who do not have enough DHA in their diet or in the maternal diet will have slightly decreased cognitive and brain development. And so at least in the States, infant formulas are fortified now with DHA. Bipolar disorder, interestingly, some moderate evidence. Depression actually should be on this list too at very high dose, some moderate evidence. So there are definitely specific conditions where adequate doses of fish oil are effective in treatment and really as effective as certain medications. So I think this is one where there are definitely certain circumstances where giving fish oil as a supplement is the right thing to do. But a lot of the most extensive use of fish oil in the States, at least over the last 20 years, has been for prevention of cardiovascular disease. And this came from those original studies of Alaskan and other Inuit populations where they high intake of fish equals low level of cardiovascular disease. And this pans out when you look at fish. So this is a study looking at meta-analysis, 315,000 participants followed for an average of 16 years. And this study kind of just completely confirms that eating fish is better than not eating fish in terms of heart disease, mortality from heart disease, etc. And that it's a low to moderate fish intake. So 1 to 4 servings a week is enough to get the benefit. Whether or not going above that adds benefit is not known. But there's this I would consider definitive information that eating fish helps prevent heart disease. But what about the studies of fish oil supplements? So this is a study, 68,000 patients, looking at whether people who take a fish oil supplement had less cardiac deaths, sudden deaths, MIs, and strokes. What they found was there was no association between fish oil and all-cause mortality, cardiac death, MI, basically anything. So they looked at taking fish oils as prevention of heart disease, and they did not find an association. Now, how about this other group? What about people that already have heart disease? Here's another study, and this looked at supplementing specifically with a fish oil extract, a supplement in people who already had cardiovascular disease, 20,000 patients. Here again, no reduced risk of overall cardiovascular events, all-cause mortality, basically no significant preventive effect. And this didn't matter how long they were treated, what dose, etc. So this really begs the question of how should we be getting our fish oil if what we're talking about is prevention of cardiovascular disease or secondary prevention. And to me, it's clear that we should be getting it from eating fish and not from taking fish oil. Having said that, there are, as I said before, clearly some specific conditions where taking fish oil is a really reasonable approach. Rheumatoid arthritis, for example. This is a Cochrane review, more recent, I think 2018, again, looking at multiple studies of adults at varying levels of cardiovascular risk, and again, finding the same thing about omega-3 supplements. So I really don't want to be discouraging. I want to be encouraging, but the challenge is, I think what I'm calling into question is, again, our romance with the pill, with taking pills, and that the way to get the health benefits, putting aside the specific diseases I listed, like rheumatoid arthritis or high triglycerides, the way to get the health benefits of fish oil is by eating fish. It seems like an obvious conclusion, but there it is. I included just briefly melatonin here because this is one of my favorite supplements to use. I've recommended it for many years for patients with really great results. Melatonin, as you know, is a hormone. It's manufactured by the body. It's not present in the diet, and it helps regulate the sleep cycle. There are a number of studies now looking at melatonin for a variety of sleep problems, jet lag in particular, but also shift workers, people who have to move from evening to daytime shifts on a regular basis, and then also elderly people generally, who often have decreased levels of melatonin. And interestingly, in studies of people who are not elderly, where there's no necessarily reason to think there's a melatonin deficiency, sometimes they show an increased level of well-being, even though the sleep latency, in other words, the time to fall asleep, is not impacted. I think very interesting. We really don't quite understand that. It's hard to find. There was initially a lot of concern about, well, this is a hormone, we're giving a hormone, is that safe? But really now, when you look across the board at the systematic reviews and the recommendations, it's very hard to find any evidence of significant safety problems. Typical dose you see there is 0.5 to 3 milligrams. I've also used this in children. If you take care of children, you know that sometimes sleep problems can be really daunting for parents. And in particular, certain categories of kids with attention deficit disorder, kids with autism. And I've used melatonin in those kids to help with sleep regulation with really good results. I will say, just because I want to be more cautious in children, in those settings, I've given melatonin, said, let's do this for a month and then stop. And then you can repeat that down the road. But it kind of makes me nervous to give it long-term to children, only because developing brain and other changes that are happening. So, but I would suggest this as one you try. The last specific topic I want to cover is probiotics. This is lactobacillus. This is bifidus. These are just two examples of the many kinds of probiotics that are out there now. The definition, which you probably know, live microorganisms, which when administered in adequate amounts confer a health benefit on the host. There are many, many, many different combinations of strains out there now, and many, many products. It can be kind of confusing figuring out the right product. This is just a one chart from one study looking at this. And as you can see, many different combinations of strains, many different products, and even many different forms. So some of these are capsules, some are powders, some are chewable tablets, some are actually reinforced foods like therapeutic yogurts. And it appears that all of these different formulations can be effective as long as you're using a quality product. And this does kind of go to a bigger question, which is how do you help choose the right product? I will say that when you're talking about nutritional supplements, let's say something like glucosamine, I worry about this less because the label will say this contains 500 milligrams per capsule of glucosamine. That's a matter-of-fact question. It can be verified biochemically, etc. When you're talking about something like probiotics or something like an herbal medicine, the quality of the manufacturer really matters. Because with probiotics in particular, sometimes products that are on the shelf, the bacteria are not live anymore. And the goal is to take these as live bacteria, which then can establish themselves in the GI tract. So you can refer back to this particular slide if you're interested in brands. These are all quality brands, but there are other ways to access good information about that, including, as I said, Natural Medicines database. So what is probiotics used for? This is probably the most widely known use, preventing antibiotic-associated diarrhea. I routinely give probiotics to patients when I'm giving an antibiotic, because you can see cuts the incidence almost in half just by using a probiotic supplement. Most of the studies just looked at single strain lactobacillus, but it appears that combinations work just as well. Irritable bowel syndrome is another condition where there's really good evidence about reducing pain and symptom scores. This is another very commonly a situation where I think probiotics can really make a difference. So you're gonna find me closing this with a raving positive review for a supplement after my fairly skeptical point of view earlier on. But I really think there's so many applications of probiotics, and really such strong evidence of safety now that really we really should be using these more. So irritable bowel, again, not as a solitary treatment, it's not a miracle, but in combination, particularly with dietary adjustments, stress management, etc., really can be very effective. Here's a very interesting kind of piece of the puzzle. Probiotics, you would think they would only work on the gut. You would think they would only work on things like diarrhea or irritable bowel. It turns out probiotics are very involved in immune function and probably contribute very heavily to regulating the immune system through their interaction with gut lining cells and the signaling that comes off of that. So this was the first large study of this, which basically showed that kids who got randomly assigned to probiotics or placebo had lower incidence, significantly lower, almost cut in half, of URI over the course of the winter. And that taking probiotic supplements daily could reduce fever, rhinorrhea, as well as school absence, etc. So you may think this was a study done in Canada, it was published in Pediatrics. You may think, how could that be? What a fluke. That doesn't make sense. But then it's been repeated over and over and over. So this is a meta-analysis from Cochrane, which was in 2015. You can see 3,700 participants, children and adults. And again, you can see they not only reduce the chances by almost half of getting an upper respiratory infection, they also reduce the duration, they reduce the likelihood of antibiotic prescription, school absence, etc. Very minimal side effects, and it's pretty interesting. So, people are always asking you, what can I do to get through the winter with less respiratory infections? This is one thing you can do. We don't know specifically if there's any impact on COVID-19. And that's an interesting question. I'm not sure if that's being studied. I imagine it's being studied somewhere. That would be a very significant finding. This is about upper respiratory infections generally, doesn't differentiate by what kind of virus. There's some evidence that it can help with treatment, even if you're not taking it for prevention on a regular basis. There's some very good evidence, and again, this probably goes to the impact on immune function, that taking probiotics in the end of pregnancy and early childhood can reduce the likelihood of developing eczema. Just a couple more. I know I'm whirlwinding through this, but I want to leave time for questions. A couple of really amazing studies. Again, you can't say enough about this. Ventilator-associated pneumonia, which is a huge cause of morbidity and mortality in kids. So they took 150 kids in the pediatric ICU, randomized to probiotics or not, and they found that the incidence of ventilator-associated pneumonia was decreased by 77%. Duration of ICU and hospital stays decreased by 2 days, 3 days. This is unbelievable, particularly given the safety margin of probiotics. Similarly, here's a study in preterm infants. Necrotizing enterocolitis is a terribly dangerous and often deadly complication of premature birth. Looked at 2,800 infants, gave them probiotic supplements, and found again, they decreased the incidence of necrotizing enterocolitis almost by 2/3. It's amazing. And no signs of significant adverse effects from this. So really, there's so much to learn about probiotics, and I would really encourage you to keep an eye on this, because there's a huge amount of research going on. I know in NIH, for example, but really across the world on this, and I think a lot of potential for great benefit here. So let me just close a couple of slides with good sources of information. This is the National Center for Complementary Integrative Health at NIH. They have a great feature called Health Topics A to Z. And here's the website at the bottom, nccih.nih.gov. So you can see, you go to Health Topics A to Z, and you can look up a wide variety of supplements. I just pulled up green tea as an example. This is a free source of information as opposed to the Natural Medicines database. Very reliable, quite conservative, but will give you information about what's known about the effect of different supplements and herbal medicines, as well as what's known about interactions. This is another really fabulous website, also free. This comes from Memorial Sloan Kettering, which, as you know, is a big cancer center in New York. And again, great source of information about herbs and botanicals. You can search for anything you're interested in. And I apologize for the long website down there, but you can just Google Sloan Kettering Herbal and you'll get to this website. Again, this is free. It's updated regularly and it's run by pharmacists at Sloan Kettering. So, you know, the information about interactions, et cetera, will be accurate. So that was a whirlwind tour. I hope that you're seeing now some sense of a destination as you think about herbs and supplements. You know, I will say this is not a subject you will study, finish learning about, and then you're done. Because if you do that, then 5 years from now, you're going to be doing something that no longer makes sense. So I'd really encourage you to look at this as a subject we're going to continue to learn about together over the years. And don't forget about food as medicine.
With that, thank you to the participants. And Ben, thank you. Special thanks to you for taking the time out of your busy schedule to be with us.
Well, thank you for having me. Really enjoyed it.
Much, and thanks to everyone.
Yes.
Bye-bye.